Hello, I'm Rodrigo from the European Commission for the Control of Foot and Mouth Disease, EuFMD. And I would like to talk to you today about a training course that we delivered earlier this year called Foot and Mouth and Similar Transboundary Animal Diseases, FAST, Crisis Management, dealing with psychological aspects and public perceptions. So for those of you who don't know, the EuFMD is a commission of the Food and Agriculture Organization, FAO, based in the headquarters in Rome. And we have 39 member nations, most of them in Europe. And we deliver a training program that aims to enhance preparedness in order to counter the threat of foot and mouth and similar transboundary animal diseases. Now, a lot of the training that we deliver, it is focusing in technical aspects of disease control. However, we shouldn't leave unnoticed some wider effects in animals and humans when we are trying to control these diseases. If we look at literature, and this is a very small glimpse, focusing only on foot and mouth disease, 2001 outbreak in Netherlands, in the UK, and 2010 in Japan, we can see that there is a recognition of the human welfare impact that animal disease control can have. Some of the extracts from these publications are mentioning communication problems perceived by the people involved, feelings like stress and bereavement in the people here involved in the disease control, either being affected by the cooling or being responsible for it, and then from where the support may come. And interestingly, farmers, at least in these articles, they are mentioning that they rely more in the conversation with the veterinarian rather than going for formalized welfare support. And recommendations in this paper talk about how the emergency response team should be trained regularly in order to be able to provide support, or at least basic support, but also to understand how these activities may affect them. So we carry out a focus group with a representative from the veterinary services of our member nations to discuss about these topics and to see if there was a perceived need on training. So when we talk with them, they identify 4 different groups: the field veterinarian, farmer, the general public, and contingency planner, and sort of issues that may raise when dealing with animal disease crisis management. And these range from ethical conflict, difficult conversations for the veterinarians, also physical demands from the farmer to also in a way for veterinarians to understand the psychological impact of the disease control on the farmer, and for vets also how to deal with activists in communication and some other areas too. And then the need of integrate those aspects in contingency planner, particularly because they recognize that there is the need to have a frame for well-being of the veterinarians and the response team in order to have a crisis management, or the management of a crisis, in an appropriate manner, efficiently, and protecting animal welfare. Considering all of the information, we define learning objectives for a proposed training course, and then we and these learning objectives focusing in 4 areas: the ethical aspects, the resilience of the veterinary services, communication path, and then how to integrate all this in contingency planning. We looked for partners, and our partners included the Center of Expertise on Animal Disease Outbreaks at the University of Edinburgh, the Veterinary Defense Society trainer, and VetMedi Uni Vienna in Austria. And the delivery was organized as a virtual workshop containing live sessions, pre-recorded material, small group discussions in Zoom, group tasks with case scenarios, and also the submission of reflective pieces. We had 85 participants from 19 different countries attending this training course. When discussing with them a lot of the aspects focus in all this ethics, communication, and well-being on the stress that different stakeholders will be feeling as a result of managing a disease crisis, particularly because of the culling and carcass disposal, the socioeconomic impact, and affecting the livelihood of people. And these problems add to things that stressor that could be a normal day by day, like trying to manage between daily responsibilities and work, but then adding to extra hours working, physical work, maybe the lack of knowledge, depending on the communication, the flow of communication and the information available, public perceptions and criticism from the public when operating culling activities, and the dealing with the conflict, with the difficult situation as well. And how much these stressors may affect could be influenced by support networks, control influence, knowledge and preparation, and that they could reduce by activities that you can have a day by day, like exercise, recognize and self-awareness of you being affected, but also from support within the organization. And this was really important because when also analyzing more closely the information and the submission from the participants, we notice that they recognize animal welfare as one of the main causes of stress that they will suffer, the veterinarians will suffer during animal disease control. So being able to safeguard animal welfare during killing activities should prevent undue stress to anyone who witness or perform such activities. But in order to safeguard this animal welfare, you need to have a team that is resilient, that is well supported, and where stress can be minimized. We know that they will be suffering ethical dilemmas when working in the population of healthy animals. We know, and they do recognize, that veterinary services should select appropriate communication techniques with dealing with animal disease control. But overall, the discussions and the proposal from the participants is that the veterinary services should provide the resources and opportunities to reduce the stress of the personnel involved in the population activities. Because again, this reduction of stress will facilitate the performance of the task in an appropriate manner, which at the same time will reflect in safeguarding animal welfare during the population activities. Participants' feedback was very positive at the end of the course. Most of them find that the course was appropriate, was quite novel for them, that it raised awareness about how to improve resilience. These are actually examples of the written feedback at the end. And it was interesting to hear comments like talking about resilience, as often there is no culture to do so. And that, I have to say, was very valuable anyway, because we were working with 19 different countries. And for some of the countries, these concepts, not necessarily resilience, but the support to the team and the well-being of the team working in a situation of an animal health crisis, it was already embedded in their contingency planning. But it wasn't it wasn't done for all of them. And the course itself, of course, was a way in which they could get stressed and be nervous when we were discussing these topics openly in groups regarding stress levels and resilience. That's not to say there is no culture to do so. What's next, though, it is to check what was the impact. I mean, we know that the training was well received, but we need to know, or we would like to know, if this have had or will have any effect in the contingency plans where these concepts could be included. So as a standard for our procedure for training courses, in a year time, we will be doing a post training feedback survey in order to gather information and see if there have been any change on the contingency planning. And also we need to continue with the conversation with the veterinary services of our member nations to see if there is a need for follow-up with this training, and particularly we are producing some standalone training material for them, particularly regarding communication and well-being. So you can follow EuFMD activities in our social media, Twitter, Facebook, LinkedIn, etc. And other than that, thank you very much for your attention, and I'm open for questions. Thank you.